Hello everyone, welcome to our channel Medico Mentor. Today we're going to talk about atherosclerosis. Today's learning objectives are: by the end of this video, you'll be able to define atherosclerosis, list its risk factors, and describe its etiopathogenesis, morphology under gross and microscopy, and little bit about complications. Contents: first we'll start with introduction, then we move on to risk factors, then etiopathogenesis, gross morphology, microscopic features, and last about complications. Atherosclerosis is a progressive disease involving the intimal layer of the blood vessels, and generally it involves large and medium-sized elastic and muscular arteries, where you'll find lipid-rich intimal lesion known as atheromas, also known as atheromatous or atherosclerotic plaques. Risk factors for atherosclerosis can be divided into major and minor risk factors. In major risk factors, it can further be divided into modifiable and non-modifiable. Non-modifiable, also known as constitutional, and you can't do anything about these risk factors. These includes genetic variation, family history, increasing age, and male sex. In modifiable, uh, it includes hyperlipidemia, which means high amount of lipid in your blood, hypertension, cigarette smoking, diabetes, and inflammation. In minor risk factors, there is obesity, type A personality, in which those person are very ambitious, they can be aggressive, and they can take stress, high intake of carbohydrates, homocystinemia, which means excess amount of cysteine. It is an amino acid in the blood which increases the risk for other heart diseases as well, and racial factors, as in African American has got a higher chance of getting atherosclerosis as compared to the Caucasians. Talking about etiopathogenesis of atherosclerosis, all those risk factors that we talked about earlier, such as hyperlipidemia, high blood pressure, diabetes, genetics, and smoking, these all are the main culprits for causing atherosclerosis. When there is increased amount of lipids, there is increased production of reactive oxygen species, which cause stress to the endothelium. They also decay nitric oxide, which is a potent vasodilator. These all factors result in a chronic endothelial injury and a state known as dysfunctional vascular endothelium. And in this endothelium, there is increased expression of pro-inflammatory genes and synthesis of cell adhesion molecules known as VCAM1 and ICAM1. And these molecules have got important function in formation of atheromas. Circulating monocytes, T cells, and platelets, they then adhere to the dysfunctional endothelium through adhesion molecules VCAM1 and ICAM1, and there is migration of monocytes into the intimal layer of the vessel. Similarly, through that dysfunctional endothelium, there is also diffusion of lipid, mainly low density lipoprotein, into the vascular intima. There is oxidation of those LDL, forming oxidized LDL, and it is a toxic molecule. The monocytes then phagocytose those toxic molecule oxidized LDL to form lipid-rich macrophages known as foam cells. So, because of these risk factors, there is dysfunctional endothelium where those monocytes can adhere to the adhesion molecules and migrate to the intimal layer. Similarly, lipid such as LDL can also diffuse through those endothelium into the subintimal layer, where these LDL are change into modified LDL, and platelet has also got a role in that. These platelets can produce malon dialdehyde, which is a product of lipid peroxidation, and these will modify LDL, and there is oxidation through reactive oxygen species forming oxidized LDL. Monocytes or macrophage can engulf these oxidized LDL to form foam cells. These oxidized LDL causes endothelial damage or necrosis. It can cause necrosis of the smooth muscle, and it can cause chemotaxis of the monocyte or macrophages to form more foam cells. Endothelial cell, activated macrophages and platelets, these all cells can release platelet-derived growth factors, epidermal growth factors, and transforming growth factor alpha. These causes proliferation of myointimal or smooth muscle cells, and also migration of these cells from medial layer to subintimal layer. Uh, we can revise a little bit about layers of vessel. So inner layer is known as intima, middle layer is media, and outer layer is adventitia. So due to these platelet derived growth factors, smooth muscle cells which are present in the media layer, they get migrated to the intima layer. Similarly, foam cells that produced as a result of ingestion of toxic LDL by monocytes, these foam cells also synthesizes cytokines such as interleukin 1 and tumor necrosis factor alpha, which stimulate synthesis of growth factors, and they cause synthesis of collagen fibers. So to summarize, proliferation of myointimal cells and migration from media to subintima by platelet-derived growth factors, oxidation of LDL or oxidized LDL, and synthesis of collagen fibers. These causes formation of atheromatous plaque. So in this figure, you can see that this is the media layer, this is intima layer, and this is the endothelial lining over here. So due to action of platelet-derived growth factors, there is proliferation of myointimal cells into the subintimal layer and proliferation of smooth muscle cells, as well as due to action of different cytokines and platelet-derived growth factors released by the foam cells. There is a synthesis of collagen fibers over here, and oxidized LDL foam cells are present in the intimal layer, and with cholesterol debris, cholesterol and cholesterol clefts in the core, forming atheromatous plaque. Grossly, these atheromatous plaque, these are yellow to tan in color. These are raised above the surrounding vessel wall, not shown in this figure, but sometimes it may be superimposed with a thrombus formation, which is a blood clot, or it can be ulcerated. In microscopy, this is H&E stained section of atheromatous plaque. You can see this is intimal layer. In intimal layer, this is outside. This is the fibrous cap, which is composed of smooth muscle and collagen fibers, and this is the lipid core, where you can see cholesterol clefts over here, uh, and foamy cells can also be seen. In between this fibrous cap and lipid core, sometimes you might see inflammatory cells in between, and there are calcific debris over present here. In the other figure, this is also H&E stained figure, but the difference is here you can see there is thrombus formation in the lumen, which is occluding the lumen altogether. This is the fibrous layer, and this is the lipid core and calcific debris. Now moving towards complication of atherosclerosis. This is normal artery. Atheromatous plaque can narrow the lumen, which restricts the flow of blood through those vessels. There can occur calcification in atheromatous plaque. There can be bleeding in those plaques. There can be thrombus formation in those plaques. And when this thrombus dislodged and moved to other location, it is known as emboli. Due to this atheromatous plaque, there is weakening of the media layer. Thus, the vessel wall becomes weak and there can be aneurysm, and this aneurysm is likely to rupture, leading to bleeding. Major clinical consequences that can occur because of atherosclerosis are: if those atherosclerosis occur in the internal carotid artery, vertebral artery, basilar artery, or middle cerebral artery, that can result in cerebral infarction. Similarly, if occur in coronary artery, can result in either angina if partial obstruction. If it is complete or more than 90%, 95% obstruction, then it can result in myocardial infarction or death of the myocardiomyocytes. If the plaque is present in abdominal aorta, and by the way, it is the most common location of occurrence of atherosclerosis. If there is partial or total obstruction, then it can result in ischemia of the distal region, distal bowel. If there is a aortic aneurysm, then there is rupture of the vessel leading to bleeding and sudden death. If the plaque is present in the anterior or posterior tibial artery, it can result in gangrenous foot. To summarize, atherosclerosis is a disease of intima with lipid-rich atheroma formation. Hyperlipidemia, hypertension, diabetes, cigarette smoking are the major modifiable risk factors involved in atherosclerosis. Talking about its pathogenesis, formation of oxidized LDL, proliferation and migration of smooth muscle from media to intima layer, and synthesis of collagen fibers are the key steps in the formation of atheroma. And talking about morphology, fibrous cap is the luminal or outer layer, which is formed by smooth muscles and collagen fibers. Then comes cellular layer, which is formed by macrophages, lymphocytes, and smooth muscle. And the central core is formed by lipid, cholesterol clefts, and foam cells. Thank you. This concludes today's lecture on atherosclerosis. Please subscribe to our channel, Medicomento, and share among your friends. Thank you.